summary, reflecting back on everything that we've talked about, some key takeaways that, I've got for, from the family point of view is that celiac disease does need to be taken seriously. You either are or you aren't, and regardless of your symptoms or your child symptoms or your family member symptoms, it is something that really needs to be taken seriously, and you do need to abide by that gluten-free diet. And it is tricky, but it gets easier. So that's probably my biggest takeaway, Sophie.
And if you have any suspicions or concerns that you or your child has celiac, going to your GP, getting checked. It's a straightforward blood test to test for celiac.
And I would add to that, Sophie, I think we were talking earlier about a patient of mine, a little girl who had gone from negative serology in December one year with mum with celiac disease, negative serology in the December to off the Richter scale by May. And it was through the mum advocating and the child being retested that we got that diagnosis. And also, if you're just because you've tested negative for celiac disease today doesn't mean that it's going to be negative next month or next year. And I get an awful lot of patients in and saying, I was tested 5 years ago, I didn't have it, I don't have it. So leaving that diagnosis open. Also, a takeaway from my perspective is learning to use that word celiac.
Yes.
And not just gluten-free. Anyone can be gluten-free, but celiac's a special